Mr. President,
Senator Gazelka.
I move that further proceedings under the roll call be dispensed with and the Sergeant of Arms be instructed to bring in the absentee members.
On that motion, all in favor say aye. Opposed say no. The motion prevails and the Sergeant at Arms will bring in the absent members. Members, please stand for the prayer. Today's chaplain is Vicar Troy Medlin from Christ Lutheran on Capitol Hill in St. Paul. And following the prayer, please remain standing for the Pledge of Allegiance.
Good morning, and I bring you greetings of grace and peace from your neighbors across the street at Christ Lutheran Church in St. Paul, a congregation of the Evangelical Lutheran Church in America. Let us pray. Mighty God of mercy, your kindness is as boundless as the highest skies, and your steadfast love as deep as the seas. You hold this whole world and even each of us in the arms of your ever-widening embrace. You are the source of all life and the fountain of all love, and we give you thanks for all the many gifts that you have given us, for waking us up this morning, and for life and breath, and for the gift of this new day, this new week filled to the brim with both opportunities and possibility, to serve you and to serve your beloved people and wondrous creation here in Minnesota. We give you thanks, O God, for each Minnesota state senator, for their families, for all Senate staff and legislative aides. Grant each one wisdom and strength, alertness and peace as they serve in this place. We pray that as they begin another day of hearings and committees, debates and votes, that you would send your spirit of compassion and courage and compromise into these halls, that seeking the common good we may always desire to hear and understand, especially those who do not look like us or act like us or vote like us, even those on the other side of the aisle, that seeing them in the best possible light we may work together towards the shared future we all desire, where Minnesota is a place of freedom and justice, and each one of us, from the Iron Range to Faribault, Rice Lake to Fergus Falls, and everywhere in between, can all flourish in life together. In the holy name of love we pray. Amen.
The Secretary will take the roll.
Senators Abler, Anderson B., Anderson P., Bach, Benson, Bigham, Chamberlain, Champion, Clausen, Cohen, Swazinski, Dahms, Dibble, Draheim, Dietzick, Eaton, Eichhorn, Eakin, Franzen, Friends, Gazelka, Goggin, Hall, Herr, Hayden, Hoffman, Housley, Howe, Ingebrigtsen, Isaacson, Jasinski, Jensen, Johnson, Kent, Kiffmeyer, Klein, Coran, Lane, Lang, Latz, Limmer, Little, Marty, Matthews, Miller, Nelson, Newman, Newton, Osmick, Pappas, Pratt, Rarick, Ralph, Rest, Rosen, Rude, Senjum, Simonson, Sparks, Tomasoni, Torres, Ray, Utke, Weber, Westrom, Uyghur, Wickland.
A quorum is present. Members, we will begin on the Senate agenda today with the second order of business, executive and official communications. The following communications listed in the agenda were received and referred as indicated. There's no further action required on those communications. Moving to the third order of business, messages from the House. The Secretary will read the messages.
Mr. President, I have the honor to announce the passage by the House of the following House files herewith transmitted. House files numbers 281, 608, 745, and 13. Patrick D. Murphy, Chief Clerk, House of Representatives.
There's no further action required on those messages. Moving to the fourth order of business, first reading of House bills. The House files listed in today's Senate agenda are given their first reading and referred as indicated. Moving to the fifth order of business, reports of committee. The Secretary will read one additional report.
Senator Benson from the Committee on Health and Human Services, Finance and Policy, to which was referred Senate File Number 278, a bill for an act relating to health care, reports the same back with a recommendation that the bill be amended as follows, and when so amended, the bill do pass and be re-referred to the Committee on Commerce and Consumer Protection, Finance and Policy.
Senator Gazelka.
Mr. President, I move the committee reports printed in the agenda and the report read by the Secretary be adopted.
On the adoption of the committee reports, all those in favor say aye. Aye. Opposed say no. Motion prevails.
I think there's several people.
Moving to the sixth order of business, second reading of Senate bills, the Secretary will read the Senate file numbers.
Senate File Numbers 955, 1694, 1940, 160, 1618, 38, 1261, 935, 938, 646, 1003, 971, and 1732.
Second reading. Moving to the seventh order of business, second reading of House bills, the Secretary will read the House file number.
House File Number 58.
Second reading. Moving to the eighth order of business, introduction and first reading of Senate bills. Members, if you look on the Senate bill introductions, you will see Senate files 2226 through 2361. There are two changes. The first is on page 2. Senate file 2237 will be referred to the Committee on Environment, Natural Resources, Policy, and Legacy Finance. And Senate File 2266 will be referred to the Committee on Judiciary and Public Safety, Finance, and Policy. These bills are given their first reading and referred as indicated. Moving to the ninth order of business, motions and resolutions. There are several authors' motions listed in today's Senate agenda. We will take these authors' motions as one motion. All those in favor say aye. Aye. Opposed say no. Motion prevails. Continuing under motions and resolutions, Senator Ingebrigtsen.
Thank you, Mr. President. I have two motions here. I move that Senate File 445 be withdrawn from the Committee on Finance and re-referred to the Committee on State Government, Finance and Policy and Elections.
And Senator Ingebrigtsen, is this your bill, and have you talked to the committee chairs?
Yes, I have. It is my bill. It is the ionizing bill, and I have talked to them as well.
On that motion, all in favor say aye. Aye. Opposed say no. Motion prevails. Senator Ingebrigtsen.
Thank you, Mr. President. I move that Senate File 1995 be withdrawn from the Committee on Judiciary and Public Safety and Policy and re-referred to the Committee on Agricultural, Rural Development, and Housing and Finance.
Again, Senator Ingebrigtsen, is this your bill, and have you notified
Mr. President and members,
chairs?
yes, it is. It's a CWD bill, and I have talked to the both chairs.
On that motion, all in favor say aye. Aye. Opposed say no. Motion prevails. Senator Jasinski.
Thank you, Mr. President. I move Senate File 1845 be withdrawn from the Committee on Family Care and Aging and be re-referred to the Committee on Human Services, Reform, and Finance Policy. This is my bill. I've talked to both chairs. This has to do with the child care assistance eligibility restrictions.
On the Jasinski motion, all those in favor say aye. Aye. Opposed say no. Motion prevails. Senator Jasinski.
Thank you, Mr. President. Another bill, I move that Senate File 1846 be withdrawn from the Committee on Family Care and Aging and re-referred to the Human Services Reform and Finance Policy. Again, this is my bill. I've talked to both chairs. This bill deals with child care, proof of surety bond, and I would ask for approval.
On Senator Hayden, discussion?
Well, thank you, Mr. President. Would Senator Jasinski yield?
Senator Jasinski will yield. Senator Hayden.
Well, Senator, it appears that you've had the second bill in a row that deals with child care issues, either licensing or other modifications that you're taking from the committee that works with child care issues and moving it up to the Human Service Reform Committee. Do we believe that the committee that Senator Housley chairs on child care shouldn't take a look at your new proposed policies?
Senator Jasinski.
Thank you, Mr. President and Senator Hayden. I believe the jurisdiction of this bill falls better underneath the Human Services Reform and Finance Policy. After that, I don't know where the bill will go.
Further discussion, Senator Hayden.
Well, thank you, Mr. President. Will Senator Jasinski continue to yield?
He will continue to yield. Senator Hayden.
Good. Well, thank you, Mr. President. Senator Jasinski, I'm sorry, I get my S's messed up a little bit here on Monday morning. But is that just what the, like who thought that that was the right thing to do? Because I know that we added child care onto Senator Housley's committee this year, and so I thought that if we were dealing with families and child care, that that's a place that gets good vetting of those issues, and if the committees seemed worthy for those bills to move forward, then it would go to the Human Service Reform for other things to look at. I am the lead on Human Service Reform, and I certainly want to take a look at it, but I'm trying to figure out if those bills don't go to Senator Housley's, then why do we have child care and family as part of Senator Housley's committee?
Senator Jasinski.
Thank you, Mr. President. Again, Senator Hayden. I've just been contacted by the chair of Human Services, Senator Abler, and he would like to hear that in his committee first.
Further discussion, Senator Hayden.
Well, thank you, Mr. President, and I guess maybe to continue to ask questions would be futile, but to the body, I think that we have a committee process set up intentionally, and that, for instance, for Senator Jasinski's bills, for another chair to call him in and to say that he'd like to see it, well, he surely can. After it's heard in the committee that it was referred to, that the president referred it to, then it can go to Health and Human Service Reform or any other committee, judiciary, or any place else that we might have to change. So I just think that this is kind of a warning. We're watching a little bit here in the minority, and some of these kind of bill transfers and re-referrals, we believe, aren't in the spirit of the committees in which we set up for this body.
Senator Housley.
Thank you, Mr. President. Senator Jasinski did talk to me about his bills, and we are not interested in hearing them in family care.
Further discussion on the Jasinski motion. Seeing none, all those in favor say aye. Aye. Opposed say no. No. Motion prevails. Continuing under motions and resolutions, Senate Resolution number 70 will be referred to the Committee on Rules and Administration. Remaining under motions and resolutions, Senator Gazelka.
Mr. President, pursuant to Rule 26, I designate the following bills be made for special orders for immediate consideration. Members, it's on your desk.
Members, the first bill up for consideration is number 47 on general orders. It is Senate File 761. Senator Dahms.
Well, thank you, Mr. President. And today I have Senate File 761, more commonly known as the Reinsurance Bill. It's rather a simple bill. The bill that we passed in 2017, it applied to 2018 and 2019 for the reinsurance. It's the same bill being carried forward. What Senate File 761 does is it does modify some of the reporting requirements to give us more reports and make those reports available to the public through the Minnesota Comprehensive Health Association's website. Also, the big part of this is it delays the transfers back of the unused state funds for the premium security plan, moves them from 2021 to 2024. And that would allow the program to continue. Just a little background on the program. We developed this program in 2017, had it implemented for the 2018 and 19 health care years. The first year it was estimated it was going to cost $271 million to provide the program. It ended up costing $139 million to provide the program. Of that $139 million, $131 million of that was paid for by the federal government. Now, there's some concern about the basic health plan. The original amount that was suggested that we would receive in 2018 was about 98 million. What we received was about 98 million less than what the original amounts that were thought we would be getting under the waiver. Keep in mind that the cost of the insurance was considerably less, in the tune of about $130 million less. Hence, most of the loss of the $98 million came because the program operated at a much lesser cost than what was projected. In 2019, we're projected to get about $85 million back from the federal government. And so the way it works out now, if you take a look at the fiscal note, at the end of 2024, we'll have a surplus of about $177 million. Now, the fiscal note shows the surplus is $231 million, but we had an amendment in finance to pay back the $54 million to the general fund, so there's $54 million being taken out of that to pay the general fund. So the program has worked very well, worked rather smoothly, and it's serviced about 166,000 people. So the request to extend the bill is to make sure that we continue to stabilize the individual health market, and we need to make sure that we keep the premiums in check, and that certainly is going to be a continuation of what the bill has done already, and going to make health insurance more affordable to our farmers, individuals, and sole proprietors that can access this health insurance coverage. So with that said, I will accept any questions.
Further discussion on Senate File 761, Senator Klein.
Mr. Chair, I move to impose a call of the Senate.
The Senate is under call.
For the duration of the bill. Mr. President.
Senator Klein.
I move that further proceedings under the roll call be dispensed with and the Sergeant-at-Arms be instructed to bring in the absent members.
On that motion, all in favor say aye. Opposed say no. The motion prevails and the Sergeant-at-Arms will bring in the absent members. Senator Klein.
Well, thank you, Mr. President. And thank you, Senator Dahms, for the bill. I'm genuinely grateful for what this bill represents, a sincere effort by this legislature to ensure affordable health care for Minnesotans and a willingness to spend serious money to achieve that outcome. I'm also grateful for the open conversation from all the health care leaders in this legislature about that elusive goal. I've benefited from the wisdom and dedication of Senators Hayden, Marty, Abler, Jensen, Benson, and Draheim, who have answered my numerous questions on everything from the mundane, such as how to implement medical care and what medical care truly costs, to the sublime, what does good health care mean, what are we capable of, and who do we want to be. Unfortunately, Mr. President, what has emerged from those vaunted and thoughtful forums is this meager and incommensurate proposition. Members, this is not the same vote you took on this issue 2 years ago, because above all, your vote today is informed by 2 years of experience in the policy of reinsurance. So consider what those 2 years have taught us. There are 3 lessons that I can see. First, the federal government is not willing to work with us to support reinsurance. Historically, our basic health plan, Minnesota Care, has received money from the federal government that we spared in federal tax credits for individuals had they purchased insurance through MNsure. But as benchmark plan offerings dropped in cost due to our state subsidies, the federal government did not hold our basic health plan funding harmless as they assured us they would. This has resulted in a loss of $167 million in federal dollars to our state in the 2 years since we implemented reinsurance. In other words, as we spend Minnesotans' tax dollars to bring down costs in the individual market, we lose almost an equal number of tax dollars to support Minnesota Care. Senator Johnson is a student of literature and will be familiar with the story of Tantalus from Greek legend. Tantalus, from whom we get the word tantalize, was punished in Hades by standing in a pool of water with a tree of ample fruit above him. He was thirsty and hungry, but as he bent to drink the water, it receded before his grasp, and as he raised his arm to the tree, the branches lifted away. Exactly so, as we spend $1 to reach our goal of health care accessibility for all, the federal government takes almost precisely that amount away under reinsurance. The last time we were voted on this proposal, it was represented that we would continue to receive that federal funding. At this vote, there is no longer any such expectation, meaning that today you are voting for a plan which is materially different and far more expensive than what you may have supported in the past. We have also learned that the health plans in Minnesota are not willing to respect our wishes to keep these dollars, Minnesota tax dollars, in Minnesota. As part of our initial work in the Senate in 2017, we repealed a provision in state law that had for years required Minnesota health plans to use their net earnings for the nonprofit purpose of providing health care in Minnesota. We repealed that common sense protection for Minnesotans, while at the same time writing reinsurance checks to the health plans for upward of $200 million. In the 2 years since, Medica, one of the health plans, has made 3 transfers totaling $175 million in the form of payments and dividends to its out-of-state operations. Our Department of Human Services has tried at every stage to slow, stop, and investigate those transfers, but they have been rendered powerless because of the 2017 repeal. And as part of our vote today on reinsurance, we are sustaining Minnesota taxpayer subsidies to plans like Medica, who have demonstrated their determination to send those dollars to states like Wisconsin. How will we answer Minnesotans who believe that this is not a good use of their tax dollars? And lastly, we have learned that while reinsurance brought down rates in the individual market on average, some customers in certain plan areas or states of our state saw an increase in out-of-pocket costs based on interaction with tax credits, and a floor handout is forthcoming that shows several such examples. Mr. President, when we last discussed this bill on the floor, we were admonished by the majority leader to remember what insurance really is, and I agree. We should have a common understanding and agreement on the purpose of insurance and what insurance companies are supposed to do. I propose that the purpose of insurance is to absorb and manage financial risk across a population, and that is the prime responsibility of our insurance plans. But as we continue down the path of reinsurance, it is worth noting that the state of Minnesota is more and more assuming that sole task from the industry. As we now pay 80% of health plan claims between $50,000 and $250,000, and the plans purchase their own secondary insurance for claims above that amount, our state plans vacate their function of financial risk management and become simply a repository for health dollars. The only mission they retain is their continued existence. Governor Walz believes that we should not continue to write checks to the health plans, but should instead write checks to individual Minnesotans who are struggling with high premiums. And that is why he has proposed a direct rebate to Minnesotans who are experiencing high premiums this year, and expanded tax credits to counter premium costs in the coming years. And with that, Mr. President, I offer the A10 amendment.
Senator Klein offers the A10 amendment. The Secretary will report the Klein amendment.
Senator Klein moves to amend Senate File 761 as follows: delete everything after the enacting clause and insert. This is the A10 amendment.
To the A10 amendment, Senator Klein.
Mr. President, I request a roll call.
A roll call has been requested. A roll call will be granted. Senator Klein.
Mr. President, the A10 amendment is a delete all amendment, and instead of continuing to write checks to our state health plans in the form of reinsurance, it pursues Governor Walz's plan of giving rebates to individual Minnesotan customers who have high premium rates, and begins to implement the tax credits for individuals who have high out-of-pocket costs to purchase insurance on the individual market.
Further discussion on the A10 amendment. Senator Dahms.
Thank you, Mr. President. First of all, I would just like to respond about the rebate program. If you take a look at the governor's budget, what he budgets for that program, and if you're currently getting tax credits that qualify under MNsure, you would not get the rebate. If you do not qualify for tax credits, you would then get the rebate. What I find interesting is that the cost of doing this rebate for the first year is $1,005 per anticipated person who would receive dollars. Comparing that to reinsurance, the cost is $534 per person. And also, reinsurance covers about 160,000 people. Another problem with the rebate is if you're right at the 400% of poverty level and you qualify for the tax credit, and if you're just a few over 400, you would qualify for the rebate. The rebate would be more than what the person that's getting the tax credit would be. So I don't understand why we're taking people that are just right off the poverty level and get under 400 for the poverty level and giving them less money that we would be giving the people that are over that. When we take a look at the cost and take a look at who we're selecting to give this money to, I don't understand why we're not defending or helping all Minnesotans instead of just a few. So with that, Mr. President, I would look at this as an unfriendly amendment and would ask that you vote against it.
Further discussion on the A10 amendment, Senator Benson.
Thank you, Mr. President. Members, just a note in the governor's budget, the premium subsidy proposal requires 51.5 FTEs to implement. So those of you who remember when MNsure first rolled out, the promises that were made, the timeliness, the absolute collapse and failure of the 2013 plan year, might want to revisit those memories before you vote yes on this amendment. This amendment would hang your hat on MNsure being able to roll out a plan sometime between July 1st and open enrollment and properly determine eligibility. And for those of you who paid attention to the last adjustment to the basic health plan trust fund or health program trust fund, you notice they failed at eligibility in 2016 and 17 to the point where we owe the feds $150 million back. So hanging your hat on MNsure for eligibility might not be a good idea. Hanging your hat on MNsure for timeliness of determination of eligibility, probably not a great idea. This is probably the least efficient way to get money into the individual market, and so I would encourage a no vote.
Further discussion on the A10 amendment. Senator Abler.
Thank you, Mr. President, and would the author of the amendment yield for a question?
Senator Klein will yield. Senator Abler.
Thank you, Mr. President. I just noticed it's actually a two-part thing. There's the rebate bit, and then there's a tax credit, if I get this right, on the second component. And actually, I like the tax credit myself. But just to the author, do you know what the tax credit would cost if we don't do reinsurance, and then if we do reinsurance?
Senator Klein.
Senator Abler, I don't have those figures immediately at hand. Do you, sir?
Further discussion, Senator Abler.
Well, thank you, Mr. President. Well, I didn't bring an amendment to the floor asking people to vote on it, so I don't know the answer to that question, and so I guess if I was a good lawyer, that I would not ask a question I don't know the answer to, but I'm not a lawyer, so we just write law here, Mr. President. We don't actually parse it some days, but anyway, here's my point. I hope that there would be a way to help people above 400%, and I think in the matter of one thing at a time. I'd like to work on this some more with you, actually. But I think if we don't do this reinsurance bill now, which nobody understands that, I think people at home are like, what's a reinsurance? That sounds like some term they don't even know what it's about. But what the point of the reinsurance program is at the base is to help families who don't get help from the state to buy their insurance. And if you have paid attention, people are being crushed by their insurance prices, especially if they're not eligible to get a program under the state or get the federal tax credits. And so it turns out I had my concerns about this, and frankly still do, about the base bill that we're doing, but I think it's one of the prudent things we have to do. Because if you're like a single mom with one child and you're making 40 grand, your insurance could be $20,000. And with this reinsurance, it's going to be less, and you're going to be able to afford your coverage. And we found that out, that the rate reductions have been in the 20 to 30% range, which is significant for that mother. Or if you have your own business, or if you're a farm couple and you're making $65,000, you don't get any help from the state. This actually has made the coverage affordable. And so that's the benefit of the bill we're talking about. It's up and running. It's actually working. There are a lot of programs that we do in Minnesota on the federal level that actually don't work. This one actually has been successful. And so Senator Klein and others who would be enticed by this amendment, without having reinsurance that helps to buy down the cost of the premiums for these single moms and farm families and independent engineers or employees of that small engineering company that can't afford to buy their coverage, it's going to cost a lot more. That's all I know, Senator Klein, is it's going to be costing 20 to 30, maybe 40% more to do this tax credit than if we do the underlying bill. And so on your election, we're going to do a delete all. And so I would suggest that maybe we can work together, and as session winds on, that we could work on this tax credit to actually make it serve. I'm kind of excited about that, but I think in combination. And so I just wanted to have that conversation. Thank you, Senator Klein. I know it's thoughtful, and you're a good senator working on behalf of what you think is the best, but I think this is, not being a farmer, there's something about carts and horses. I think the cart should go after the horse. Thank you.
Further discussion on the A10 amendment, Senator Klein.
Well, thank you, Mr. President. Thank you, Senator Abler, for the discussion of carts and horses. This is our opportunity, Minnesotans. 2 years ago, we passed this reinsurance plan in what I gather was a bit of an emergency messaging type of situation, where we needed to do something fairly urgently to prop up the individual market. And nobody liked writing big checks to insurance companies, but it was the price we felt we had to pay, and we agreed to develop something better over the subsequent 2 years. And now we're back 2 years later with precisely the same plan extending forward. So this is your opportunity with the A10 members to vote to do something different, direct your tax dollars to individual Minnesotans who have high health care costs and not to our insurance plans. So I urge your green vote on the A10.
Further discussion on the A10 amendment, Senator Dahms.
Thank you, Mr. President. I would just also like to point out, when we talk about this 20% rebate, in the hearings that we had, we did have testimony that the insurance rates would go up 50 to 54%. If they went up 50% and you had a $10,000 premium, your new premium would be $15,000. You're going to get a 20% rebate, so you're going to get $3,000. So before the rebate, you were paying $10,000. After the rebate, you're paying $12,000. And I guess that's pretty hard to understand how that's helping people that are on the individual market. I start to wonder what direction we're really trying to go with some of these things. When we look back, we started with the Affordable Care Act. And we can all remember so well how we were going to save 40% and be able to keep our doctor and all this and all that. Well, it's Affordable Care Act, came down to Minnesota, and then MNsure came about. What were the results of that? Individual market premiums going sky high. So now we've got a program that helps correct that, but it's maybe not accomplishing some of the things that some people want to accomplish. So we come up with something else. But we don't want to talk about the unintended consequences. And I think when we start looking at shifting over to the rebate, we've laid out a couple of pretty good unintended consequences. And myself, I would rather see a large group of people helped and not increase their costs like apparently the rebate would do. So again, I'd request a no vote.
Further discussion on the A10 amendment, Senator Hayden.
Well, thank you, Mr. President, and I rise to support the Klein amendment. One of the things that a lot's been said and a lot's been bandied about Senator Abler kind of asked a non-rhetorical question, and we're trying to kind of work through that, and even has suggested that maybe this isn't the rest. In addition to that, Senator Dahms kind of throws out 50%, 60, 40, 30, 20. Well, we don't really know. Like, the insurance companies are the ones who dictate that to us. They just simply say it. We don't always know if what they're saying is true. We can't always get behind their numbers. Senator Marty's going to talk a little bit later, I think, to preview about where the money goes. The money's going out of state. The money's going to for-profits. That's something that this legislature put in, to transfer money, our good money, out to a for-profit. I'm previewing probably what my third reading speech is going to be, but let me get to this. A salient point is the money that we lost on the BHP, we won't lose on Senator Klein's amendment. It doesn't have the interplay with the rates that way. So we can figure out what the numbers are periodically. We can figure out, I'm trying to see if my colleague over here has something going and I can't hear myself. But we can figure out kind of where that interplay is. But what we do know is that we'll save money, that we won't lose money in the BHP for working, low-income working Minnesotans that we all said that we care for. That's Minnesota care. So I think that the Klein Amendment is smart. I think it's an opportunity for us to take a look at it. And I will add that 2 years ago we said it was an emergency, and this year we're coming back with it's another emergency. We've had task force, we've had committees, we've had the interim to try to figure this out. And what we do is we come with the same old solution, which is to write big checks to insurance companies. If we're going to write a check, Minnesotans, I'd rather write it directly to the consumer so that they can offset the cost of their insurance as opposed to writing it to insurance companies.
Mr. President?
Senator Benson.
To that point, a number of times it's been raised that the insurance companies gave us the rates that Senator Dahms has been quoting. So I requested the rates from the Department of Commerce that the Department of Commerce must have developed in order to be certain what the MNsure budget would be and what the cost of the 20% rebate would be. Those rates have not been made available to this body throughout the course of that debate. And so the best information that we have right now is the information that Senator Dahms has from the insurance companies.
Further discussion on the A10 amendment, Senator Nelson.
Thank you, Mr. President. I rise against the A10 amendment because the A10 amendment does nothing to help stabilize the individual market. It does nothing to bring down those costs. Members, I would refer you to an article from the New York Times that has been placed on your desk talking about reinsurance. And I will save my comments until after third reading to talk about why the bill before you today is the bill that we can support because it will stabilize the market. It does hold down premiums. And just a little bit about Insurance 101, when it comes to pre-existing conditions and expensive conditions, being able to spread those across the market is what holds down those costs. Insurance is the law of big numbers. And so I would encourage you to vote against the A10 amendment because it is not going to help preserve the individual market. It is not going to help hold down those costs. It does cost money for the state, but it is merely a Band-Aid and it doesn't help address the underlying issue. I'll speak more to the bill in total, but the A10 amendment, while well intended, does not serve the purpose.
Further discussion on the A10 amendment, Senator Marty.
Thank you, Mr. President. I wanted to second one of the points that Senator Hayden made in response to Senator Dahms, and that is that when we are talking about this, you have to factor in the other federal dollars being influenced by this. And the money that we received for the for the reinsurance basically was then taken away from us in the basic health plan funding from the federal government, almost dollar for dollar. And when you factor in the impact on the premium tax credits and so on, buying down the rates through this reinsurance is basically going to take away that many federal dollars. Senator Dahms, you talk about how if we don't provide this reinsurance, if we don't reinsure the insurance industry, that it's going to drive up rates 50%. Well, that's a possible number, I suppose. But what did it save in the last couple of years? I think it was 17.5%. So saying, well, if we take this away now, they'll go up by 50%. If we put it back on, it'll save 17%. The math doesn't work that way. And the bottom line is that Senator Klein's amendment, which I strongly support, would provide the funding directly to the people who are being impacted. It does not have the negative impact on some of the people who are getting the APTC, because again, depending on how it works for each individual, some of them could be paying more because of this. Because as we buy down that rate by 20%, those are folks who every dollar their premium goes down, their APTC from the federal government goes down $1. So some of them are going to have a slight increase, some are going to have decreases. Bottom line is that reinsuring the insurance industry, that's supposed to be their business, but by subsidizing the insurance industry here, instead of giving it directly to people, I think that we're making a huge mistake. We can't know the numbers, as you said. In Senator Klein's bill, we know where the money is going to. It looks to me, from the numbers and the analysis I've seen, that it's slightly cheaper for us to go with Senator Klein's amendment than it is to go the other one, and it's not going to have the negative impacts on some of the recipients of the subsidy.
Further discussion on the A10 amendment, Senator Dahms? Any further discussion on the A10 amendment? Seeing none, the Secretary will take the roll on the Klein A10 amendment. All senators having voted who have the desire to vote, the Secretary will close the roll. There being 30 ayes and 34 nays, the motion does not prevail. The amendment is not adopted. Continuing on with discussion on Senate File 761. Senator Marty.
Mr. President, I have the A14 amendment at the desk.
Senator Marty has the A14 amendment. The Secretary will report the Marty amendment.
Senator Marty moves to amend Senate File number 761 as follows. Page 1 after line 6, insert. This is the A14 amendment.
To the A14 amendment, Senator Marty.
Thank you, Mr. President. I would like a roll call on this, but the A14 amendment is one that would undo a change that we made into the law 2 years ago. If we are going to provide one more subsidy for the insurance companies here by reinsuring them, this would take away a provision that was put into law a couple of years ago that allowed for-profit insurance companies to move into Minnesota. And the consequences of that have been, among other things, that the insurance industry has started taking some of their assets, their reserves, whatever you want to call it, but their earnings that they made off of our public programs and so on, and they want to convert that. They're converting that to other purposes, to for-profit subsidiaries in other places. And bottom line is, if we're going to be subsidizing the industry again, the least we can do is protect our public assets that are in these programs. And I will say that the whole idea that was adopted 2 years ago, saying that Minnesota was the one state that didn't have for-profit insurance companies, health insurance companies in Minnesota, was that somehow we were doing worse than the other 49 states in this, and by allowing people who are going to make profit off of this to come in is going to help us somehow. Well, for-profit insurance companies have two ways to do what they have to do, and that is look out for the interests of their shareholders, one of which is to drive up the premiums, which is not what we're trying to accomplish here. We're trying to accomplish the opposite. And the other one is to deny claims or reduce the amount they pay out, which is also not what we're trying to accomplish here. So the whole concept of for-profit insurance industry here was, health insurance industry here, was opposite of the direction of what we should be doing. And if we're going to be subsidizing the insurance industry one more time, the least we can do is take that away. And so I ask for your support on the A14 amendment and go back. In that case, it was to the status we had before 2 years ago. It will stop these transfers of funds, and will stop companies who are coming in so they can make more money off of our health insurance system.
A roll call vote was requested and will be granted. Further discussion on the Marty A.
Mr. President,
amendment. Senator Dahms.
I question germaneness on this under 35.2. Number 2, it says intended to accomplish a substantially different purpose than that of the original bill which is proposed. And I think this certainly is a different discussion. This is a discussion about how the insurance companies that can be in reinsurance and that, how they're based profit-wise, and not about the actual insurance. So I would question germaneness.
Senator Dahms has raised the question of germaneness on the A14 amendment. Any advice? Senator Marty.
Thank you, Mr. President. I would argue it is germane. Basically, this is trying to deal with, if we're going to provide a subsidy to the insurance companies, the least we can do is put some conditions on that, including that they can't convert or become for-profit insurance companies, and that they cannot transfer their assets to other entities such as for-profit insurance companies. So this is clearly a condition that's appropriate when we're providing a huge mega $1 million subsidy to the insurance industry. We can put some reasonable conditions on them, and that's what this amendment would do.
Any further advice on the Dahms point of order? Senator Hayden.
Thank you, Mr. President. Advice. Simply, it was germane when we did the last reinsurance bill. We added these provisions in there in order for for-profits to come in. So why wouldn't it be germane for this bill?
Further discussion, Senator Dahms.
Thank you, Mr. President. I think we need to also keep in mind the fact that the concern apparently seems to be that it's going to change the cost of health insurance. Keep in mind that all rates of health insurance have to be approved by the Department of Commerce. So I would question that the Department of Commerce is going to allow the rates to be higher because they're profit or non-profit. I don't believe that. And the Department of Commerce does look at those rates. They're the ones that authorize the rates. And so whether it's profit or non-profit, I don't think makes any difference. But the point is it does substantially change the purpose of the bill.
Further advice, Senator Benson.
Mr. President, advice to Senator Hayden's point. Reinsurance and the nonprofit, the for-profit HMO provision traveled in Senate File 1 in 2017. Senate File 820, which was the reinsurance bill, was standalone when it passed this body, and therefore undermines his germaneness argument. No motion was made to amend Senate File 820, and so thus undermining Senator Hayden's germaneness argument. I concur with Senator Dahms. It deals with a completely different subject than stabilization of the market.
Any further advice? See no further advice. I rule that the point of order is well taken and the amendment is not germane. Further discussion on Senate File 761.
Mr. Chairman, I challenge the ruling of the chair and ask for a roll call.
Senator Marty challenges the ruling of the president. Members, in the Senate Rules 14.4 says an appeal is decided by a majority vote of those present and voting. Upon an appeal of the decision of the president, the question is, shall the decision of the president be the judgment of the Senate? A green vote is in favor of the judgment of the president, and a red vote is against the judgment of the president. The secretary will take the roll.
I think Isaacson's going to join us too.
All senators having voted who have the desire to vote, the secretary will close the roll. There being 34 ayes and 30 nays, the judgment of the president is upheld. The amendment is not germane.
Mr. President.
Further discussion on Senate File 761. Senator Marty.
Thank you, Mr. President. Then I'll try the A16 amendment.
Senator Marty offers the A16 amendment. The secretary will report the Marty amendment.
Senator Marty moves to amend Senate File number 761 as follows, page 1 after line insert. This is the A16 amendment.
To the A16 amendment, Senator Marty.
Thank you, Mr. Chair. Mr. President, this amendment does fit in this bill. This one is germane. This simply says to be an eligible health carrier. In other words, one of the carriers that is eligible to participate in the subsidy program, that they would have to, this would be restoring one small portion of the language that was repealed a couple years ago. They would have to make sure that all of the health carriers' net earnings are devoted to providing comprehensive health care. That way, they have to be spent the way they would. This is the language that was taken out along with the for-profit status at that time. If we are going to subsidize these companies, the least we can do is make sure they can't take the assets we are providing them and transfer them elsewhere for other purposes. So this amendment simply says if you want to get the subsidy, you can't transfer the money somewhere else. It's only a small portion of what we should be doing, but at least it would provide some accountability there. And Mr. President, I ask for a roll call.
A roll call will be granted. Further discussion on the Marty A16 amendment. Senator Dahms.
Thank you, Mr. President. I find it interesting to accomplish what we might want to achieve, that now we're going to tell insurance companies that we don't want them to take any money for their overhead and operating expenses. I question why we'd be trying to do that. I think the subject today is to try to get the insurance cost as low as we can, and it seems like for some reason we keep dodging around that. And so I would say that I personally, I can't support this amendment, and I think it's an unfortunate day when we decide on the Senate floor that we're going to tell the private industry that you can't use any of our money to cover any overhead or anything like that.
Further discussion on the A16 amendment. Senator Marty.
Mr. President, this objectionable language to Senator Dahms is what we had in the law before. It basically said that HMOs had to spend all of their assets on providing health care. We're just reinstating that into the law, and you're saying this is somehow objectionable because they can't function then. They functioned before in the past, they can function this way. It simply would stop the transfer of their assets, which are funded by tax dollars. We're taking their assets and saying you can't spend them for other purposes anymore. You can't transfer them to other states or for-profit entities or anything else. You can only use it for providing the health care you're supposed to be paying for. So as all this does, it's not something scary. It's what used to be in the law.
Any further discussion on the A16 amendment? Seeing no further discussion, the Secretary will take the roll on the A16 amendment. All senators having voted who have the desire to vote, the Secretary will close the roll. There being 28 ayes and 36 nays, the motion does not prevail. The amendment is not adopted. Further discussion on Senate File 761. Seeing no further, Senator Wicklund.
Thank you, Mr. President. I have the A13 amendment I'd like to offer.
Senator Wicklund offers the A13 amendment. The Secretary will report the Wicklund amendment.
Senator Wicklund moves to amend Senate File number 761 as follows, page 1, line 16, delete. This is the A13 amendment.
To the A13 amendment, Senator Wicklund.
Thank you, Mr. President. Yes, this amendment, as we just spoke in the previous amendment about how we would like to see the health carriers focus the money that is taxpayer money going into this program, focus it on health care and try and incent them to reduce the costs in the system. And that amendment did not prevail, but this amendment simply would add some additional reporting functions, so at least we have some visibility into where the money that is taxpayer money going into the reinsurance program, where it is going. Today, there's few requirements for reporting. The bill adds a few more requirements for reporting. But Minnesotans deserve to have visibility into where the taxpayer funds are going, and this would add provisions to report on the claims payments submitted for payment on and off the exchange per for each product and per eligible health carrier. Today, we don't have any visibility into where the funds go per plan. This would add that requirement. This would also add that the total amount of reinsurance payment made would be broken down by each eligible health carrier. Senator Dahms had added that administrative and operational expenses incurred are reported on, but it doesn't really, it doesn't break down that with granularity. So my amendment would add that it would include the total amount incurred administratively and as a percentage of the plan's operational budget. And then there would be reporting each year that would break down what are the federal and state contributions that are received, what investment income is coming in based on this money that is not, it's not all being used each year. Are we receiving any investment income into the account, and any other revenue or funds received? This, Mr. President, would give us a little bit more visibility into the money. The last time when this bill came forward, it was stated that we don't have time to decide on ways to provide some greater accountability. I think we need to add that accountability and visibility now if we are to move this reinsurance plan forward. Thank you, Mr. President.
Further discussion on the Wickland A13 amendment. Senator Dahms.
Well, thank you, Mr. President, and I would accept this as a friendly amendment.
Any further discussion on the amendment? Seeing none, all those in favor of the Wickland A13 amendment say aye. Aye. Opposed say no. Motion prevails and the amendment is adopted. Further discussion on Senate File 761. See no further discussion. The Secretary will give Senate File 761 its third reading.
Senate File number 761, a bill for an act relating to state government.
Third reading. Any further discussion on Senate File 761? Senator Nelson.
Thank you, Mr. President. I just wanted to bring attention to some of the findings regarding our Minnesota Premium Security Plan. I just want to note a couple aspects for you. The New York Times article states that the efforts that led to this creation hold lessons for other states that are also seeing rapidly rising rates. And it is an instructive experience, what we did here in Minnesota. And I believe Senator Dahms stated that we're not authorizing any more funding. We're allowing the existing funding to be used in the following years to also hold down premiums. I particularly wanted to draw your attention to what Governor Dayton said about this reinsurance plan. And I quote, he said, "I applaud the Minnesota legislators who worked together to pass this pioneering legislation, which is being shown to cause major reductions in the cost of health insurance next year for many thousands of Minnesotans." I'd also quote that the reinsurance program promises more stability, and that's what we are looking for in that insurance market, particularly the individual market, which, according to our own people, was on the verge of collapse before the reinsurance program. The reinsurance program allows the spread of high-cost cases across the individual market. It leads to stability. And if you do not want a government-run insurance, we need to have stable insurance markets. Then State Senator Tony Laurie, now of course Commissioner, said, "Reinsurance itself is a good tool, a valuable tool to mitigate premium spikes, and this program does work." Members, I encourage, whether you supported the reinsurance program when it first was passed or not, today, I encourage a green vote for a program, a reinsurance program that is not going to cost the state any additional funds and is going to help stabilize the market and hold down premiums.
Further discussion on Senate File 761. Senator Klein.
Well, thank you, Mr. President. Thank you again, Senator Dahms, for bringing the bill, and to the healthcare leaders on both sides of the aisle in the Senate for being committed to holding down healthcare costs for Minnesotans. I earnestly am glad that we take that job seriously and are working to accomplish that goal. It is, however, the case, Mr. President, that Minnesotans send us here with the anticipation we will spend their tax dollars responsibly. There may have been some understanding 2 years ago when urgent action was needed, but with the passage of 2 years and what we've learned about the implementation of Minnesota Care, what we've learned about the loss dollar for dollar in federal funding for our basic health plan, what we've learned about the willingness of our state health plans to move their assets out of state even after we give them Minnesotans' tax dollars to supplement their budgets, does not constitute a responsible use of tax dollars. I think Minnesotans want us to work on a better plan. I think the governor has proposed some innovative solutions. And today, members, I urge your red vote.
Final discussion on Senate File 761 as amended. Senator Marty.
Thank you, Mr. President. I think I could make a pretty good prediction that if this bill passes today, we will reinsure the insurance industry again, and 2 years from now we will back and we will reinsure the insurance industry again, because this is not a fix. It's a very temporary solution. And as we do that, we ought to make sure that this temporary solution is done the right way. And Senator Klein offered the governor's proposal earlier, which covers about the same 80,000 people, would affect about 80,000 people, not the entire 166,000 in the private insurance market, which is a whopping 3% of the public, but a small portion of that, because anybody who's getting an advanced premium tax credit from the federal government right now, every dollar their premium goes up, they get another dollar in the premium tax credit. So in effect, they're not seeing the increase. So it's about 80,000 people affected by it. Likewise, Senator Dahms's bill would affect about the same 80,000 people. And the cost of the subsidy in the governor's budget is listed as $336 million for the next biennium. The cost of reinsurance in the Senate fiscal note on Senator Dahms's bill is $359 million. It's more expensive. So when you net out all the costs from the federal government and everything else, the governor's proposal, as offered by Senator Klein, is actually a cheaper way of doing it. But fundamentally, one of the concerns I have, and one of the reasons I urge you to oppose this bill, not just because it's a temporary fix, not just because it's very expensive, but because we voted down an amendment earlier which would have said that the insurance companies, which we are subsidizing through this bill, can turn over their nonprofit assets to other purposes. We could have said, as a condition of getting this money, you can't transfer your assets to for-profits or other states or anybody else or any other purpose. You got to use it for the health care that was intended for, the law we used to have before 2 years ago. So if we are going to fix, or at least make a temporary patch on this 3% of our insurance market, then maybe what we ought to do is at least make sure there's some accountability there. I'm glad Senator Wickland offered that amendment for some accountability, but at least make sure they can't transfer the assets. They're public assets. We're using tax dollars to fund it. Make sure they can only be using it for health care. If we're going to subsidize the market, the least we can do is give it directly to the people who will benefit from it, rather than giving it to the companies which have showed they would rather spend it for some other thing. So I urge your rejection of this bill. I'm hopeful the House will come up with the governor's proposal. I think that's a better way of addressing it. But let's not think this is a fix. Let's think of this as we're going to be back 2 years from now discussing reinsurance again unless we make other changes. Urge your opposition to the bill.
Final discussion on Senate File 761 as amended. Senator Hayden.
Well, thank you, Mr. President, and I rise in opposition of the bill. Members, we keep talking about this and we talked about it 2 years ago as a temporary fix. Senator Nelson reflected as a Band-Aid. Senator Abler said that he didn't know if he liked the underlying bill, but he didn't like the cart and the horse, or how we should go about it, but he wanted to somehow figure that out. Members, this is not becoming a temporary fix. This is becoming the fix. This is becoming the way that we're going to do it. Someone said, one of my colleagues said, if we don't like government-run health care, we shouldn't vote for this. Well, this is government-run health care. We're spending money, outsourcing money to insurance companies that are unaccountable, that are sending money to other places, spaces that we don't know about, taking hard-earned tax-paying revenue that we've given them, and now they get to do what they want. Mr. President, will Senator Dahms yield for a question?
Senator Dahms will yield. Senator Hayden.
Well, thank you, Mr. President. Senator Dahms, I've asked you this question every time on every stop, and I'll ask it again. Do you believe that we should repeal the sunset on the provider tax?
Mr. President and Senator Hayden, I'm not going to get into that discussion today. Today I brought this bill in reinsurance, and I'm going to keep my parameters of my discussions around reinsurance. You've asked this question in every committee that you've been at, and the answer is the same. Thank you, Senator Hayden.
Further discussion, Senator Hayden.
Well, thank you, Mr. President, and thank you, Senator Dahms. I knew you'd be consistent with that because that's what you are. You're a good legislator. I was going to say a really good legislator, and that's what you do is you stay consistent. And the reason why I asked that question, members, is that there is interplay here. This does drain the provider tax. This is the funding mechanism for reinsurance. This is the funding mechanism, the provider tax and the healthcare access fund for the basic health plan or Minnesota Care. It does provide us, and we're going to have another discussion, I would hope at some point, on the provider tax and the healthcare access fund. But I can't find the nexus between wanting to extend the reinsurance program, what appears to be in perpetuity, but then take away the funding mechanism that will keep it there. We're going to have to make some tough choices around here, and I do think that this is premature. I do think that there are other ways in which we can figure out how to provide health care to a subset of Minnesotans, or at least insurance to pay for their health care to a subset of Minnesotans who need it. The pre-existing condition is something that 4 or 5 years ago when I was around here, people didn't quite know if they liked that provision in the ACA. They thought going to MNsure, which is the underlying pinnings of this bill, and having high deductibles and high premiums and catastrophic care was the only place that if you had a pre-existing condition, that's where you should get it. That was the good old days. We romanticized that. It wasn't so good for the people who had to pay for that, and some of our folks around here know about that. So we added in this issue, or this provision in the ACA that said pre-existing conditions, and everybody seems to like that, and somehow this is a place in which we're going to be able to pay for that. Well, once again, the context has changed. I do want to refer to, Mr. President, and I hope that this doesn't extend the debate, but Senator Nelson spoke about now Commissioner, former Senator Lori, and she underlined and highlighted some things that I guess that's the only thing that we were supposed to read is what she circled and highlighted. But I'd like to read from her own document that she passed out that it said Senator Lori, a senior Democrat on the Health Committees in the Minnesota State Senate, said he voted against the legislation because it was financed mainly with money from a fund intended for a separate state health care program for the working poor. And then he said what Senator Nelson said. So I want to make sure when we read that, we read the whole thing because it gets at the point that we have here. And one of the salient points that we made is that this is taking money from the basic health plan, Minnesota Care, the one that we value, the one that's a nation-leading program that helps working poor, hard-working people be able to afford their health care. So it appears that we're picking and choosing winners here, and the losers now are poor people, low-income people. Hard-working, low-income people in Minnesota seems to be the loser, one of the big losers in the way that we finance that. So, Mr. President, I'm not sure. I think I've said everything that everybody else is saying. There may be more people who want to say that. But this is not the right time. It's not the right space. And I got a funny feeling that we'll be back again giving away hundreds of millions of dollars to unaccountable insurance companies who send their money out of state that we don't know what's happening because somebody said, because they said that rates are going to go up this amount. I'd much rather spend our money with Minnesotans and give it directly to them to make the decision to buy down their health care costs. I urge a red vote.
Final discussion on Senate File 761 as amended. Senator Jensen.
Thank you, Mr. President. And I thank Senator Dahms for bringing this bill to us. And I very much appreciate the conversation that has taken place from both sides of the aisle. Throughout this last 2 months of discussion regarding reinsurance, I've been pleased and impressed with the fact that Senator Dahms realizes that this isn't the do-all, end-all. This isn't the silver bullet that's going to solve our problem. This is not a situation that we wanted to be in. Some of this comes from the fact that our nation is crying for a discussion regarding health care, and that discussion is taking place, and certainly the Affordable Care Act has stimulated that discussion and moved it forward. If you go back to the MCHIP plan that we used a long time ago, the biggest difference between this reinsurance and that reinsurance is that was a prospective reinsurance plan. This is a retrospective. But in both situations, the pre-existing condition protection that is so critical to all Minnesotans is embedded within this bill. So that won't change. I would take issue with Senator Hayden's comment that we might be perceiving this as the fix. I certainly don't. I see it as, if you will, a temporary stopgap measure. I have bills that come in conflict with this that I would like to see considered along the way. I'm confident that Senator Dahms and the leadership in the Senate will, at some point in time, look favorably upon those bills. But for now, it is not difficult for me to support this bill because it does get things secured. I know it may not get across the finish line in time for the insurance companies to do their work prior to the end of March. I've had many conversations with Senator Lori regarding this bill and how it might blend or work with others. I think the Affordable Care Act stumbled when it so ambitiously required the 10 essential health benefits that are so expensive. And I think it also stumbled when it created a rate cliff at 400% of the federal poverty line. It grieves me that we still have winners and losers such that if your income is 390% of the federal poverty line or 410%, you might go from paying 10% of your adjusted gross income for a silver premium all the way up to 25 or 30%. I think these are problems that cry out for a solution. So, with no further ado, thank you, Senator Dahms, for presenting this bill, and you certainly have my support today.
Final discussion on Senate File 761 as amended. Senator Hoffman.
Thank you, Mr. President. And members, since we want to talk about the fiscal cliff here that seems to be, I would wonder if in the discussion we cared to look at the fact that the top CEOs in the state of Minnesota all seem to come from the insurance industry. We know one, Health Partners, top 22 executives make $32 million a year. United Health, which isn't part of this but will be next year, just paid its CEO $20 million in an attaboy kind of payment. And I'm wondering, as we go forward, where is this discussion of the money getting to the individuals who desperately need the support that they're here? And I would hope that the next time we come around, as my good friend Senator Hayden talks about, that we would have that deep discussion to find out what is our moral obligation. Is it to fund wealthy people's salaries, or is it to make sure that those that most desperately need the services and the insurance that it's getting to? And I would just want to make sure, members, that we are having that discussion at the next stop.
Final discussion on Senate File 761 as amended. Senator Benson.
Thank you, Mr. President and members. As we discuss the individual market, let's talk about some of the people who are in that individual market. People who don't have employer-sponsored coverage, who aren't eligible for public programs, who aren't on Medicare, Medicaid, Minnesota Care. These are people who are entrepreneurs, who are out making it on their own. They bear the cost of their coverage in a way no one else in our health system does. Everyone else either gets tax advantaged or gets a significant subsidy through our public programs. And so some of this is a fairness issue. Additionally, we have to remember Minnesota, and MSHA has been brought up a lot, has had a market stabilization tool in place for a long time. When the Affordable Care Act was put into place, it removed some of the key provisions of MSHA, and it put approximately 28,000 Minnesotans who had not been in the individual market fully into the individual market. And it caused some instability, but reinsurance at the federal level provided a counterbalance. In spite of that, we saw historic increases in rates. In 2016, federal reinsurance was removed by design from the federal law. It was expensive, and when the Affordable Care Act was passed, their goal was to keep it under $1 trillion over 10 years. That's why reinsurance was limited at the federal level. Rates for 2017, again, saw historic increases, and when we came into session for that 2017 plan year, we passed a premium subsidy and reinsurance because we knew the individuals in the individual market needed our help. Our reinsurance model was modeled after that federal structure so that it would be easy for the plans to implement, understand, and provide optimal stability in this market, and it performed as promised. We received a 5-year waiver, and Senator Dahms' bill just extends it so that we can continue to see stability in this important part of our economy. Without reinsurance, rates will rise again this fall. The governor and his supporters have said the governor has a plan, a premium subsidy and a tax program. But what I haven't seen is what the rates are under that plan. What I haven't seen is a letter from CMS saying they will in fact hold the BHP harmless, as has been purported. That they will in fact count rates before the rebate as the effective rate for calculating advanced premium tax credits. And again, members, I'd remind you, if you're hanging your hat on the way MNsure implements things, you have forgotten your history. There's no dispute rates will rise. And voting no on this today says you're okay with taking the risk on a governor's plan that hasn't been implemented. We need to have rates filed by May. We need to move quickly, or we will have uncertainty in the rates that are filed. And again, uncertainty in the insurance market causes unnecessary increase. Farmers, entrepreneurs, and those who are at the core of the innovation economy are counting on us to have choice and accessibility, and reinsurance does that. It also helps with affordability in the market, but that overlooks other important bills that Republicans are moving today to increase transparency and accountability in our healthcare system. Those bills are moving along in the policy and budget process, and I am proud of so many of our freshmen who have stepped up, listened to Minnesotans, and are acting on behalf of their constituents. So members, if we are going to continue health reform in Minnesota, this is an important part of it. This will keep rates stable for the fall and let us continue to do important consumer-based reforms that will further bring down the cost of care in Minnesota. I ask you to support Senator Dahms with the green vote.
Final discussion on Senate Files 761 as amended. Senator Dahms.
Well, thank you, Mr. President and members. I urge a green vote on this. I think it is an excellent bill. A couple of things I want to point out in closing is number one is that we keep talking about the BHP payments and how the federal government short paid us by, it's actually 98 million, but 100 is what's usually referred to. But my question would be this. We originally figured that the cost was going to be 271 million. It turned out to be 139. Do we really expect the federal government just to give us that difference when a lot of their decision on how much we were going to get was based on what the cost would be? And that cost was considerably less, but it accomplished what we said we could accomplish with it. So I don't know how come that's such a struggle for people to see that if you spend a lot less, you're probably going to get less. The other thing that I want to just address a little bit is, you know, I understand that we lose some BHP money, But are we really here just to raise the coffers of the BHP money, or are we here to do what's best for the Minnesota citizens? And I think at this point in time, this bill is the one that will do the best for the Minnesota citizens. As I pointed out earlier, the cost of the rebate will be considerably higher per person that is helped versus reinsurance. Besides that, we're adding another 50 people, and we don't need to do that. We don't need to be adding growth. We need to be getting the money to the people that need it to keep their health insurance rates down. But it seems to be a priority around here to grow the bureaucracy and forget about the small people out in rural Minnesota that need help. Another thing I'd like to talk about is a comment was made about giving money to the uncontrollable, unaccounted insurance companies. Let's look at MNsure, how accountable and controllable that is. How many hundreds of millions of dollars have been taken because of people that didn't qualify, that were allowed to be eligible? You know, we can call the kettle black a lot, but sometimes we better make sure we're looking to see what's in it. At the end of the day, we need to do something, and I think that this is probably the best option we have. And I find it interesting that Representative Angie Craig's first bill was a premium security bill in the amount of 10% at the federal level. Also, I find it interesting that Senator Klobuchar has been very, very supportive, and she's been very vocal about her support for a premium security program. And the bill that we just heard today, that's the same bill that Representative Halverson heard in her committee as chair of the Commerce over in the House. So with that said, I urge a green vote, and thank you very much.
Final discussion on Senate File 761 as amended. Senator Gazelka.
Thank you, Mr. President. Members, this is an important bill, and I want to just give a little bit of history. I wish, frankly, that this isn't where we were. I wish that we didn't have Obamacare. I wish we had what we had in Minnesota a decade or so ago, where those, frankly, that couldn't get insurance in other states because of pre-existing conditions in Minnesota, you got coverage. In other states, when you were 25 years old, you couldn't be on your parents' plan. In Minnesota, you could be. We took care of the low-income people with Minnesota Care. And above that, we had a robust private market where people had all kinds of options all across the state. We don't have that now. I hope someday we go towards something like that, but that's not what we have now. And so as Obamacare rolled out, with federal government meaning well and wanting more public input into what we have with our health care, and things began to fall apart, we realized that we had to do something for those people, typically farmers, small business owners, individuals that had to get health insurance in the individual market. We had to do something for them because we took the people that were in MNsure, higher risk people, and merged them together, and guess what? Their rates were too high because of what we had done. And so I worked with Governor Dayton, and we figured out that this had to be done in a timely manner. In fact, 2 years ago, roughly now, the Governor Dayton and I realized that if we didn't do it in March, we brought more unpredictability to the market. And so we passed and the governor signed the reinsurance bill of that time, not knowing for sure what was going to happen. But what did happen? Well, where rates had been going up sky high for a couple of years, rates were stabilized. In fact, rates went down more than we expected. And the money that we set aside for it, we thought would be good for 2 years. Frankly, that's going to be good for 5 years. We don't need any more money. We just get to spread out the money that we had in there. A big success in light of the decision we had to make. And so today, you know, as we're looking at this, I appreciate, frankly, that even in there, Senator Jensen talked about pre-existing conditions. Again, we're affirming that that's something that we are going to make sure is taken care of, but was taken care of before in Minnesota as well. But so moving forward, signing this bill or voting for this bill, members, it isn't, like Senator Jensen said, a silver bullet, but it does buy us more time as we're working at what are the things that we can do to actually drive down the cost. And it isn't more government-run health care. I hope someday we learn that more of what we just did is not going to bring us to where we want to be. But it does buy us 3 more years of time when we figure out what we're going to do. But then it sits in the House. Is the House going to pass it? Are we going to get it to the governor? Or are we going to wait? And it's something I'm going to push on, just like working with Governor Dayton, where we worked and got it done and got it signed and got predictability into the market. I'm going to push for that because I think it matters for Minnesotans, particularly those farmers and small business owners that are impacted by this. So, members, I encourage you to vote green.
Seeing no further discussion, the Secretary will take the roll on final passage of Senate File 761 as amended. All senators having voted who have the desire to vote, the Secretary will close the roll. There being 37 ayes and 28 nays, the bill is passed and its title agreed to. Remaining under motions and resolutions, we will move to the 13th order of business, announcements of Senate interest. Without objection, the following senators will be excused. Senators Herr and Howe all day. Senator Torres Ray from 11 a.m. to 12:15 p.m. Any further announcements of Senate interest? Senator Gazelka. Senator Gazelka.
Mr. President, I move the Senate do now adjourn until Wednesday, March 13th at 11 a.m.
Senator Gazelka moves that the Senate do now adjourn until Wednesday, March 13th at 11 a.m. All those in favor say aye. Opposed say no. Motion prevails. The Senate is adjourned.